Hi, my name is Yolanda Shanwan. I'm a registered nurse at the Cleveland VA, and also I've worked at the Cleveland Clinic. Many times our patients are discharged home on medications such as heparin, insulin, or Lovenox, which requires a subcutaneous injection. Today we're going to learn how to inject subcutaneous medication in the home. Some gauze. You will also need a Band-Aid, and you will also need 2 pairs of gloves. Sometimes your gloves may tear, so that's why I require that you have 2 pairs of gloves. And you will have your subcutaneous injection needle, which many times comes with medication already filled. Now, I'm going to show you the areas that we give the subcutaneous injections. Some of these areas that require the subcutaneous injections are, you want to give it into the arms, you want to give it into the thighs, or you want to give it into the abdomen. You want to make sure that you rotate the sites because you don't want them to cause any scars, or you don't want the tissue to break down. So the first thing we will do, we want to make sure we wash our hands. You want to get your gloves once your hands are washed. I'm going to put our gloves on. You want to get your alcohol swab ready. Okay, you want to clean this area. We're going to give a subcutaneous injection here in the arm. You want to make sure that you pinch the skin because you want to go in at a 45-degree angle. You also want to make sure, like I said, you pinch it in at 1 inch. And the next thing we're going to do, we're going to get our needle here. For the sole purpose of this video, we are going to give the injection into a potato instead of our human being. We've already cleaned the area with the alcohol. We are going to take the cap off our needle. We're going to pinch 2 inches here, which is the skin. And we want to make sure that we go in at a 45-degree angle. And once we go in at a 45-degree angle, make sure the needle is all the way in, and we're going to push down on the barrel and in the medication, the needle, we're going to insert the medication. Once the medication is administered, usually with the subcutaneous injection, we usually have no bleeding, but in case there is a bleeding, we'll use a little gauze here. There's no bleeding, so now place your Band-Aid. In summary, the diagram shows the subcutaneous sites for the injection, and remember to go in at a 45-degree angle. This concludes the video on how to give a subcutaneous injection in the home.